Cosmetic surgery is something which is done for patients who are not sick or unwell. Everybody having a smartphone or sabko with very easy ways they can take pictures, they can be out there. Especially young girls and young men are worried about wo kaise dikhenge in front of the camera. Person has to understand ki it is not possible for me to take out Kylie Jenner's nose and put it on you, or Meghan Markle's nose and put it on you. It is not going to happen. 75% I think is females who come with these requests. So now also when I see breast reduction candidates who are coming in, a lot of them have back pain, they have neck pain, they have shoulder pain from typically slouching in front or leaning too much in the back. But किसी को अगर एक हिडन चोट लगी है, जैसे विद इन देमसेल्व्स, उनके कॉन्फिडेंस को या उनके मेंटल स्ट्रेंथ को जो दिखती नहीं है, उसका ट्रीटमेंट कभी कभी कुछ बॉडी प्रोसीजर्स से हो सकता है. बट द पर्सन हु इज एक्चुअली सफरिंग नोज हाउ मच ऑफ अ डिफरेंस इट क्रिएट्स टू देयर लाइव्स.
ब्यूटी स्टैंडर्ड्स बढ़ जाने की वजह से सेल्फ एस्टीम इश्यूज ने लोगों को स्ट्रेस्ड कर दिया है. ऐसे में इन मुद्दों का समाधान करते हैं हमारे कॉस्मेटिक सर्जन्स. तो आज मेरे साथ हैं जानी मानी कॉस्मेटिक सर्जन डॉक्टर देवयानी बर्वे वेंकट. वेलकम टू द शो डॉक्टर.
थैंक यू सो मच फॉर हैविंग मी.
प्लास्टिक सर्जन्स के साथ एक कुछ लोगों की ऐसी नेगेटिव सोच जुड़ी हुई है, स्टीरियोटाइप सोच जिसे आप कह सकते हैं, कि कुछ डॉक्टर्स पैसे के लिए प्रोसीजर्स को प्रमोट करते हैं विच आर एक्चुअली नॉट रिक्वायर्ड. तो आपका इस पे क्या टेक है?
So plastic surgery and especially cosmetic surgery is something which is done for patients who are not sick or unwell from the normal point of view. बट कुछ प्रोसीजर्स ऐसे होते हैं जैसे ब्रेस्ट रिडक्शन या राइनोप्लास्टी या इवन अब्डोमिनोप्लास्टीज जो हम करते हैं, जिससे कुछ फिजिकल कंप्लेंट्स और कुछ मेंटल कंप्लेंट्स भी सॉल्व हो जाती हैं
जी.
सो जैसे अभी किसी को अगर चोट लग गई, उसका आप ट्रीटमेंट कराते हो. बट किसी को अगर एक हिडन चोट लगी है, जैसे विद इन देमसेल्व्स, उनके कॉन्फिडेंस को या उनके मेंटल स्ट्रेंथ को जो दिखती नहीं है, उसका ट्रीटमेंट कभी कभी कुछ बॉडी प्रोसीजर्स से हो सकता है. एक एग्जांपल दूंगी. एक पेरेंट आया था मेरे पास, वन फादर हैड कम, जिसका 16-year-old boy was in 10th standard. They were not from Bombay, but he was getting bullied every single day. Because he had developed a little female-like looking breast tissue. Abhi 16 is normally not an age where we will offer surgery. But the situation was such that that boy was crying every day, refusing to go to school. So I told the father that I'm going to take an extra step and I want to do a video consultation with the mother also.
Okay.
So I did a video call with both of them and I asked the mother, how severe is this problem? Because as a doctor, I don't want to take a decision for any patient which is premature or which will not be helpful. Okay. So yes, correction of this is a purely cosmetic reason, but there is a very significant mental health issue associated with some of these procedures.
Correct.
जब मैंने मदर से बात की तो she was very genuine. She said that उसकी 10th चल रही है. He is refusing to go to school. He ties himself tightly with like a bandage or a dupatta and then wears a t-shirt if he has to go somewhere. And उसकी वजह से उसको chest पे bruises हो चुके हैं.
Oh my God.
So I did offer him surgery. They came after 2 months once some prelims or something was done. They got operated. And the feedback I got after 6 months was life altering.
Wow.
That boy had tremendous confidence. He did well in his exams. And he was finally able to go just with a t-shirt, play basketball, do things which a normal 16, 17-year-old should be able to do. And this I was able to fix with a procedure which took 1.5 घंटा. That's it. Very safe. But there was a reason behind it. In such a case, normal people will feel ki what was the need for this surgery? कुछ जरूरत नहीं है. But the person who's actually suffering knows how much of a difference it creates to their lives. So I just want to tell people that if you have some particular change in your mind, so I always tell my patients कि you read up about it, what kind of change you're looking for. You read up about which doctor you want to go for discussing this. And after the discussion, you and the doctor together should be able to decide whether it is actually required or it can be avoided or something simpler can be done. So options are always there. But ऐसे प्रेजुडिस्ड होके जस्ट डिसमिस करना कि ये जरूरत ही नहीं है शुड नॉट बी डन इन माय ओपिनियन.
सो डॉक्टर देवयानी, इन दिनों महिलाओं पे परफेक्ट दिखने का बहुत ज्यादा प्रेशर है. आपके पास भी ऐसे पेशेंट्स आते होंगे जो बहुत सेल्फ एस्टीम में लो होते हैं, फिर आपके पास से मुस्कुरा कर जाते हैं.
सो डेफिनेटली आजकल बिकॉज ऑफ everybody having a smartphone और सबको with very easy ways they can take pictures, they can be out there. Instagram hai, YouTube hai, Reels hai, everything is there. So lot of especially young girls and young men are worried about वो कैसे दिखेंगे in front of the camera. So this is an important aspect which we have to take care of as a doctor. You're right, काफी लोग आते हैं जो जिनका मेन कंप्लेंट होता है कि in front of a camera or when I take a picture of myself, I don't look very nice, or my nose looks crooked, or my cheek looks unequal. So ऐसे पेशेंट्स आते हैं जिनको लगता है कि उनके बॉडी प्रोपोर्शंस ठीक नहीं है, बट वो जब एनालाइज कर रहे हैं खुद को, तो आई हैव टू एज अ डॉक्टर, एज अ प्रोफेशनल, आई हैव टू अंडरस्टैंड कि वो किस नजरिए से खुद को देख रहे हैं. Is it only because they are not looking a certain way in front of a mirror or a camera, or you know how their partner perceives them, or is it actually from an aesthetic point of view, is there actually a difference? So normally अगर देखने जाएं तो right और left side of the body same नहीं होता है. Minor differences रहते ही हैं.
Even nose में भी होता है.
Nose में भी रहते हैं. Exactly. Eyes में भी होते हैं. Forehead में होता है. चीक के ये प्लम्प एरिया में भी डिफरेंसेस होते हैं. सो दिस इज ऑल नॉर्मल. Not just the face, but even the rest of the body, like say the breast or the arms, thighs, there will be a slight difference. So you cannot expect yourself, or nobody should expect themselves to be exactly equal. पर मेरे पास जब पेशेंट्स आते हैं तो I try to understand what is the driving force behind them asking for that change. So इनमें से genuine cases जो है उनको थोड़ा filter करना पड़ता है, और जो थोड़े maybe they are getting, you know, guided away by the pressure of looking good.
Social media.
Yes. So you have to kind of find a happy medium between the two. So जो genuine cases है, like जिनको genuinely breast asymmetry है, suppose एक breast एक cup size का है, दूसरा दूसरे cup size का है, genuinely problem है clothes पहनते वक्त, या you know when you're with your partner or husband or whoever it is, तो वो cases actually treatment के लिए qualify करते हैं. With respect to the face, अगर कोई बहुत exacting है अपने requirements में, कि समझो 10 फोटो लेके आते हैं कि मुझे ये सेलिब्रिटी जैसे दिखना है, तो then we are a little, yes, absolutely.
Oh God.
So we are a little cautious then, because see, it is after all a surgical procedure. Or even if we are doing fillers, which is non-surgical, it is some intervention which is being done. So person to person variation आने वाला है उसमें. So the person has to understand कि it is not possible for me to take out say Kylie Jenner's nose and put it on you, or Meghan Markle's nose and put it on you. It is not going to happen. Your nose will be improved or made better in a certain way, but एक से एग्जैक्ट कॉपी पेस्ट नहीं होने वाला है,
क्योंकि फिल्टर तो नहीं लगा सकते ना. आप जैसे कि वो लोग एडिट कर सकते हैं अपने मोबाइल पे या अपने लैपटॉप पे.
एग्जैक्टली, एब्सोल्युटली.
कुछ ऐसे भी पेशेंट्स होते होंगे जिनको आप घर वापस भेज देते हैं कि नहीं, आपको रिक्वायरमेंट नहीं है, आप मत करवाइए काउंसलिंग करके.
हाँ, ऐसे भी आते हैं. आई वुड से 10-15% ऐसे रहते हैं जो आते हैं विद वेरी स्पेसिफिक रिक्वायरमेंट्स कि मेरी नाक थोड़ी सी ऊपर है, मुझे उसको थोड़ा सा नीचे करना है इस फोटो की तरह.
Oh God.
So then I have to sit them down. I have to understand reason behind their wanting to get the surgery done. What is their motivation? And फिर अगर possible है नहीं है ये सोच के I have to guide them. So थोड़ा सा guidance counselor type भी रोल होता है हमारा कभी-कभी.
तो ये प्रेशर फीमेल्स में ज्यादा है.
फीमेल्स में बहुत ज्यादा है.
बहुत ज्यादा है ना. And the young kids?
Yes, 75% I think is females who come with these requests. 25% young men में भी है who are especially into say fitness, bodybuilding, who are swimmers. So उनको अपना face और upper body especially और maybe even legs, calves कैसे दिखते हैं, they are very well aware of it. So sometimes, very rarely, I do get requests for something which is quite rare, but calf implants to make the legs look a little muscular, or putting extra fat into the arms, जो bicep bulge होता है उसको recreate करने के लिए. So ये unusual requests होते हैं. Depending on how the person is as a patient, कितना realistic है, उस हिसाब से we decide whether it should be done, should not be done, and after adequate counseling, of course.
So it's not only from the showbiz, as in models or actors ही नहीं, किसी भी field से आजकल लोग आ रहे हैं.
Yes, absolutely.
And the new bride must be coming.
Absolutely. So typically 1 से 1.5 साल पहले जब मैरिज की बातें चल रही है, that is when most girls come. Because recovery में थोड़ा time लगता है, so they want to get maybe some liposuction done, or they want to get some breast surgery done, or something like that. Facial, some alterations, nose अगर करना है किसी को, तो we do get brides, we do get young, who want to get into the media business or something like that. We do get people who are seeking a change.
So Dr. Devayani, सबसे पहले कौन सी ऐसी बात थी, कौन सी ऐसी चीज थी जिसने आपको बहुत अट्रैक्ट किया प्लास्टिक सर्जरी के तरफ कि मैं यही करूंगी?
So actually, training through, I have always been interested in surgery. And जब general surgery मैंने training की, उस टाइम पे मैंने 1-2 पेशेंट्स ऐसे देखे थे जिनका हाथ बहुत इंजोर हो चुका था, या जिनका फेस एसिड से खराब हो चुका था, और उनका जैसे ट्रीटमेंट हुआ और जिस तरह से they benefited from the whole thing, not just appearance wise, but simple चीज जैसे being able to open their mouth or being able to move their hand, and the kind of difference it made to their lives, that is kind of what told me that okay, this is the field in which I want to go. Because it's not restricted to any one organ. ऐसे नहीं है कि बस heart treat कर रहे हैं या बस lungs treat कर रहे हैं. Head to toe, all areas can be treated with plastic surgery.
And you're making a difference in people's lives.
Exactly. So like that was blessing. Paramount. That was most important.
So Dr. Devayani, कितना safe है plastic surgery?
Plastic surgery के 2 parts है. One is purely reconstructive. जब हम किसी को कैंसर हुआ है या किसी को एक्सीडेंट हुआ है तो उसको हम रिपेयर करते हैं. और दूसरा पार्ट है कॉस्मेटिक और एस्थेटिक सर्जरी, जिसमें पेशेंट is not actually unwell, but they are seeking some kind of change or improvement in their body image, their appearance. So safety wise, the profile of these procedures has changed drastically in the last 5-10 years. Anesthesia is extremely safe, जिनको anesthesia की जरूरत है. Otherwise, lot of procedures are done as office procedures under local anesthesia. Okay. And so far, anesthesia related या कोई भी major related complications we have not had.
So what is the procedure like from consultation till the time the patient gets discharged?
Correct. That's a very nice question. I think that will help a lot of people. The basic thing is the patients or the people who come to me usually have an idea of what they want to do. ऐसे नहीं है कि आ गए और they will tell me कि आप बताओ क्या करना है. It's not like that. They will either come to me कि टमी बहुत बढ़ गया है और उसकी वजह से बैक पेन हो रहा है, या ब्रेस्ट अनइक्वल है, या ब्रेस्ट बहुत हैवी है, इसकी वजह से नेक शोल्डर पेन हो रहा है, आई मे वांट टू गेट अ ब्रेस्ट रिडक्शन डन. सो यूजुअली दे विल हैव अ प्रोसीजर इन माइंड. वो उसके बारे में थोड़ा बहुत पढ़ के फिर मेरे पास आएंगे, एंड देन व्हाट दे आर लुकिंग फ्रॉम मी इज टू असेस what their problem actually is, whether that surgery is correct for them, and whether any other procedure will be safer or better or will give a nicer result with less surgical intervention. So अगर वो सोच रहे हैं कि मुझे बहुत बड़ी सर्जरी की जरूरत है, if I can give them the same thing in a smaller procedure, it is obviously better for everybody. So typically patient comes in for a consultation. पहला consultation half an hour 45 minutes तक जाता ही है. Usually I will examine them, I will understand what their history is like, medical, surgical, क्या क्या हुआ है, and then I will suggest what I think they need. I will try to understand from them what their requirements are. And then I have a whole library of photos. So that helps patients a lot.
To take a decision.
Yes. So I have before surgery pictures, after surgery pictures, before any particular fillers or Botox, jo kuch kiya hai.
Like we can see here.
Yeah, something like that. So I show them what patients I have treated before. Of course, privacy is maintained in all this, but I show them what has been done, and then based on that, they get an idea how their procedure will turn out. So that helps them a lot. And uske baad, then if they are open to going ahead with the surgery, once we have discussed the pros and cons and everything, then we plan the surgery in future.
What about the complications? Are there any?
So after all, like I said, it's a surgical procedure. There can be some complications. The most commonly complications which we discuss are like any other surgery, some amount of infection, some amount of bleeding. But fortunately, in these cosmetic surgery procedures, because the patient is not really unwell or sick in any way, the risk of complications is very, very low. But uske बावजूद भी we get all the tests done. We make sure that the patients are fit. There is nothing which we take for granted. And surgery is done in a good setup with good care, good backup available. ऐसे नहीं है कि कहीं पहुंच गए क्लिनिक में चले गए सर्जरी कर ली निकल गए. That should not happen. I won't say that doesn't happen, but that should not happen. And safety is paramount in all these procedures.
Complications भी temporary होते होंगे, कुछ time के बाद ठीक हो जाते हैं, जैसे कि आपने कहा कि infections and all.
Correct. So mostly usual healing period होता है हर procedure का, maybe 2 weeks, 3 weeks. Long-term complications which will trouble somebody for a lifetime generally नहीं होता इन सब procedures में, because they are very safe procedures.
And बहुत सारे viewers का ये भी सवाल था, मैंने जब research किया तो मुझे पता लगा कि local anesthesia कौन देता है, आप देते हैं या आप के साथ कोई assistant doctor है वो देते हैं?
So अगर local anesthesia है, local anesthesia means जो area हम operate कर रहे हैं बस उसी को नाम या सुन किया जाता है. तो local anesthesia है तो I only give it because that is under my training or this is something which we routinely do. But अगर patient को major procedure है, जैसे से tummy tuck करना है या breast implants करने हैं या rhinoplasty करना है, तो I will make sure that I have a anesthetist available with me who will perform the procedure. So I am free along with my assistant or my nurse, whoever is there, to do the procedure.
Okay.
And while I'm doing the procedure, patient जो बेहोश है या partially anesthetized है, somebody else is looking after them.
What is the cost of the entire surgery, ma'am? It varies from different
Correct.
surgeries, but then around कितना prepared होके आना चाहिए?
Procedure cost varies on a lot of things. Especially in a place like Bombay, it will vary, of course, based on the procedure, but it varies based on which hospital you want to do it at, which category of room you want to do it in. अगर आपको suite में कराना है तो it will be very expensive. अगर आपको sharing room या daycare में अगर आपका procedure हो जाता है, then the costs are low. So range अगर देना है for a surgical procedure, it can vary from anything between 50,000 to maybe 4 lakhs.
Okay.
So depends. अगर बहुत minor procedure है, छोटा कुछ कर रहे हैं, तो maybe 50-60,000 में सब कुछ हो जाता है. But अगर major कुछ है, जैसे 6-8 घंटे चलने वाला कुछ procedure है, तो it can go in lakhs.
And recovery period also varies?
Recovery period varies. So typically, if you ask me, the quickest recovery is for a procedure such as liposuction, because skin punctures बहुत छोटे होते हैं. And you just have to wear a garment after surgery. There is no suture removal या ऐसे कुछ. And the longest recovery period typically is for facial procedures and rhinoplasty. That is a nose job. Because nose की skin Indian लोगों में काफी thick होती है. तो इसके लिए जो कुछ हम changes अंदर करते हैं, for those changes to show on somebody's face, it will take time. It can take up to 9 months for a rhinoplasty result to be seen.
कुछ लोगों का query है कि rhinoplasty के बाद लोगों का voice change हो जाता है, is it true?
अगर किसी को nasal voice है पहले, मतलब nose अगर blocked है और उसकी वजह से nasal twang है थोड़ा बात करने में, और rhinoplasty या septoplasty से हम nasal passage open कर देते हैं, तो थोड़ा voice change हो सकता है. बट रूटीन सर्जरी के बाद नहीं होना चाहिए.
अबाउट लिपोसेक्शन कराने के बाद फिर से फैट आ जाता है, तो कितना ऑफन कराना पड़ता है, या फिर इट्स सेफ, लाइक एक बार करा लिया यू कैन मेंटेन?
Liposuction should be a one-time procedure. We always tell patients, whether you're undergoing liposuction or tummy tuck or any body shaping procedure, you have to maintain your weight. Plus minus 5% is okay. But अगर liposuction कराते हो, perfect shaping हो चुका है और उसके बाद you put on say 10, 15, 20 kilo, then it is going to show somewhere. So discipline in life, discipline in exercise or your dietary habits is important
Is a
to
must.
maintain any result.
तो दोबारा कराने की भी जरूरत पड़ती है कुछ लोग?
Hopefully not.
But there are patients who come.
There are rarely who patients who come back, but usually they will come for spot reduction. मतलब not for the whole, जैसे whole body या torso को पूरा नहीं करना पड़ेगा. Just love handles थोड़े से हैं या arms है, तो small areas can be redone, but generally not recommended, or if it's not even required to do the whole procedure again.
And how safe is breast implants?
So breast implants now, the ones which we get are very safe. I've kept because patients are always interested, breast implants कैसे दिखते हैं. So this is a typical breast implant. This is what actually goes inside the body. These are 5th generation silicone implants which are very safe. If you cut this implant in half, there will be 2 pieces. There is no gel inside.
Okay.
So there is no leaking which happens जो पहले stories होती थी. Yes. So there is no leaking. In fact, these are very, very strong and durable. If you search on YouTube, you will find some videos where a Hummer has gone on an implant and nothing has happened to it. So that way implants are very safe. However, each person's body reacts differently. So it is recommended that every 3 years you get a breast checkup done to make sure that everything is doing okay. There
And
is no
in implants
issue.
की life कितनी होती?
So company की तरफ से they say it will last a lifetime. We recommend at least 15 to 20 years they will easily last.
Okay.
After that your body also changes. So breast का shape change होगा, you will become older. So उसके basis पे अगर implant को exchange करना पड़ा या remove करना पड़ा, तो that is possible.
That is again safe कि इसे change करके दूसरा replacement.
Yes, that is very safe. No problem at all.
And after the like implants, कुछ लोगों को backache और इसका भी शिकायत होता है. Is it true?
Very rarely. That's why I've kept this implant also. Now, this is a very big implant. I do not recommend them in normal people. There are sometimes patients who want big implants, but they have to understand that big implants also change your center of gravity. जैसे आप front heavy हो जाओगे, तो you will want to tilt your back backwards. तो उससे बैक पेन स्टार्ट हो सकता है. सो दिस इज लाइक एन एवरेज साइज्ड इम्प्लांट जो हम इससे थोड़ा कम या इससे थोड़ा बड़ा जनरली यूज करते हैं डिफरेंट शेप्स पे. बट बिग इम्प्लांट्स हैव दैट रिस्क कि किसी को बैक पेन शुरू हो गया या किसी को पॉस्चरल थोड़ा सा पॉस्चर या वॉकिंग में थोड़ा सा चेंज हो गया. So that all that you have to discuss with the doctor before you actually go in for that size of implants.
And breast reduction surgery जिसे mammoplasty भी कहते हैं, उसका actually आपको लगता है कि जरूरत होता है या?
So breast reduction, is something which is very, it's one of the reasons again why I chose plastic surgery. I'll tell you a story of one patient. I have studied in PGI Chandigarh, so I was 3 years there. And once in OPD we saw a 14-year-old girl who had come actually holding her breasts in her hand. So her breasts were almost 2.5 kilos on each side. And she was so thin, wiry thin. So such a patient is suffering. Even if she is 14, normally we don't operate before 18 because we want the breasts to finish their growth. But you can't let a child like that suffer. So we operated on her. We removed almost 2 kilos from each side such that she could, at least walk straight without having to hold her breasts. And by the time I finished my training, she had come back with regrowth. So she had some other issues as well, which were also being treated. But this is what really inspired me to, take up plastic surgery being a female. So this kind of a patient does need intervention. You cannot leave such a child because of, whatever society feels about it. So now also when I see breast reduction candidates who are coming in, a lot of them have back pain, they have neck pain, they have shoulder pain from typically slouching in front or leaning too much in the back, and they have lot of body image issues.
Oh.
So these patients don't get appropriate clothes to wear. Some of them have never even worn a swimming suit because it looks odd and people stare. I have another story of a patient very early when I started practice. This lady had come to me with her husband, and her breast size was some 34 G or H cup, which is very big. And the husband was very supportive, and they were totally, for the procedure. And she went home after, discussing everything with me. And then she called me back saying that I can't do the procedure because my mother is refusing. So I said, you're suffering. If you want, you come with your mother. I will explain it to her. Then you decide. She's like, no. My mother said, I have lived with it for so many years. Why do you need a surgery? You can also live with it. So this is the kind of approach which sometimes hurts us as doctors, because the procedure is safe when done appropriately in the correct setting and for the right reasons.
So, and the patient is suffering.
Yes,
so
it gives very good results. And why not? I mean, if somebody is going to get more self-confidence, if they are going to get rid of their back pain, neck pain, their postural issues, the way they view themselves, why not offer them a surgery which is, it's not purely cosmetic, it is something which is kind of changing their whole body language. Breast reduction now, fortunately, because I'm a female surgeon, I see a lot of patients of breast reduction, and we do at least one.
It's safe because a lot of tissues are going out from your body.
Yeah, but it's safe. It's safe.
It's safe.
The way it's done, and of course the procedure keeps evolving, but the way we do it presently, it is very safe with very low risks and relatively quick recovery. 2 to 3 weeks is the recovery for a breast reduction. And we end up seeing maybe 3-4 patients a week for this now, and maybe 1 or 2 surgeries a week. So that's quite a bit.
So, what is the difference between lip filler, lip implant, and what are the different surgeries which are done for lip lifting? Yes.
So, surgery or interventions for lips have evolved over the years. The options available with us are either filling the lip. So, if somebody wants, people come with both requests. They want lips to be bigger, and very rarely they do come with requests to make the lips smaller. So, making it smaller, there is no other option. We have to surgically do it, cut out a portion of the lip and suture it back. So that is called lip reduction. Lip enhancement or lip filling is the more common request. So now the standard of care is basically lip fillers.
Okay.
So we put in maybe 1 syringe, or if at all required, sometimes 2 syringes into the lip. And the result is instant. There is some swelling initially, but which goes away in a day or two. And the result is immediate. The only difference is that lip fillers need to be redone every 1.5 to 2 years. Lip filling with fat is another option.
Implants?
Implants are very rare.
Okay.
Very, very rare. So
implants are different.
Implants are different. So implant will be like this, which is which is made of silicone. So they will be like a silicone little sliver, which is put inside the lip. But with lips which move so much, while talking, while pouting or whatever, the chance of the implant coming out or getting extruded is very, very high.
Okay. So you do not suggest that?
No, lip
filler
implants,
is better.
Fillers are the best. Fat I have done for some patients who want a more permanent kind of result, who don't want to keep coming again and again. But again, because...
How is fat different? Sorry to interrupt.
So fat is when we take fat from the patient's own body, clean it, make it a little liquid and put it back in the lip.
And it's safe? It
is safe. But again, the downside is that fat also tends to get digested by the body.
Okay, yes.
So the size goes down.
Then again, it is required after 1.5 years?
Again, it will be required. Maybe not 1.5 years, but 3-4 years definitely. So in that sense, when you compare the two procedures, lip fillers are much better than doing lip
fillers
fat.
Are like injections.
Fillers are injections.
And you have to take them like after a year or 2.
So yeah, typically about 1.5 to 2 years, you will have to redo it. And most patients, 1 syringe is enough for the whole lip kind of to be shaped.
Tell us all about Botox.
So Botox is a very favorite procedure amongst everybody, honestly. Even people who don't need it sometimes come in asking for it because they've heard about it, you know. So what is Botox? Botox is basically a neurotoxin. Botox is the company name,
Okay.
but it's basically a neurotoxin, which means it paralyzes the muscles.
Okay.
And why do we inject Botox? So the muscles which are working on your face, which create wrinkles, those muscles get paralyzed or softened by Botox.
Okay.
Okay, it paralyzes those muscles either fully or partially. So the wrinkles, the lines, fine lines which are developing on your face, they don't develop as early as they otherwise would. So typically there is no exact age to start Botox. Some people start developing lines over their forehead or around their eyes, or you know, here in the center.
Thing.
Crow's feet, or these forehead lines, or this, you know, this which comes. So to avoid that from becoming a permanent line, that is when Botox should be used. So now I have had patients who have come in at 25 also. Okay, you know, I don't want to develop any lines at all.
Oh God.
So I send them back. If they don't have prominent lines, okay, then they don't need to start Botox so early, because in your 20s typically you're not going to develop prominent lines. At the same time, I have had patients who are close to their 40s who still have not developed prominent lines. So you have to see each patient, and it doesn't mean that just because you turn 30, chalo, start karo Botox.
Each body is different.
Exactly. So you don't need to jump into it just because the world is doing it at 28 or 30. So Botox overall बहुत ही simple procedure है. It can be done as a office procedure. 15-20 मिनट लगते हैं. रिजल्ट टेक्स 2 to 3 days, क्योंकि वो ड्रग का एक्शन आने में उतना टाइम लगता है. बट वेरी द बेसिक प्रोसीजर कोई भी एंटी एजिंग के लिए अगर करना हो तो वन शुड थिंक ऑफ बोटॉक्स.
ओके. एंड व्हाट आर द डिफरेंट एंटी एजिंग प्रोसीजर्स लाइक?
सो बेसिकली ये स्टार्ट होता है फेशियल एनालिसिस के साथ. फेस जैसे हम जानते हैं अपर 1/3, मिडिल 1/3 और लोअर 1/3 होता है. सो अपर 1/3 के लिए मेनली बोटॉक्स ही है. कभी कभी किसी को आईब्राउ ड्रूप हो गया हो जो बोटॉक्स से करेक्ट नहीं हो रहा है, तो उनको आईब्राउ के लिए थ्रेड्स कर सकते हैं हम लोग. थ्रेड्स इंटरनल जाते हैं स्किन के नीचे, विच विल पुल अप द आईब्राउ लिटिल बिट. और अगर उससे भी नहीं हो रहा है तो सर्जिकल ब्राउ लिफ्ट, बट वो बहुत रेयरली लगता है. मिडिल ऑफ द फेस जो होता है, चीक्स, अंडर आईज, या ये जो लाइंस डेवलप होती हैं, सो उसके लिए काफी ऑप्शंस हैं अभी. easiest option is fillers again, जिसको हम चीक में डाल सकते हैं, यहाँ पे डाल सकते हैं, आईज के नीचे डाल सकते हैं, to fill up the volume which is lost as one starts aging. So जैसे एजिंग प्रोसेस होता है, फेस की फैट कम हो जाती है, फेस के जो मसल्स हैं वो लूजन हो जाते हैं, और जिनको रिपोजिशन करना पड़ता है उनको वापस ऊपर लेके जाना पड़ता है और उनको फिलअप करना पड़ता है. So fillers is the easiest. Threads is another thing which we sometimes do. It is again a office procedure. एक घंटा लगता है उसको करने में. थोड़ा सा local anesthesia दे देते हैं, and under the skin we pass threads which have small hooks on them.
Okay.
So which pull the skin upwards.
Okay.
And उसका result 1.5 2 years, कभी कभी 3-4 साल भी रहता है. Depends on which thread you're using. So threads is a good option. Non-surgical ultrasound जो skin tighten करता है, that is also another option which people can use, but वो बहुत early cases में ही applicable है. So fillers, threads, और उसके बाद भी अगर किसी को करेक्ट नहीं हो रहा है, जो स्किन एक्सेस है, स्किन लूजनिंग हो गया है, तो फेसलिफ्ट.
Okay.
तो फेसलिफ्ट इज अ सर्जिकल प्रोसीजर. Of course, it is in सबके comparison में it is the best procedure, and it lasts also the longest. But after all, it's a surgery. So as a last resort only हम वो advise करते हैं. Mainly fillers और threads से जितना facial lifting या facial tightening हो सकता है वो achieve करते हैं. और lower face की बात करें तो
the jawline and all people correct it.
So jawline is something which, as aging happens, the angle of the jaw starts becoming softer and skin नीचे sag होता है, तो उसको tighten करने के लिए again fillers is an excellent option. जॉ लाइन के जो फिलर्स आते हैं वो लॉन्गर लास्टिंग भी होते हैं, वो एटलीस्ट 2 years तक दे विल स्टे इन योर बॉडी एंड आफ्टर दैट द बॉडी विल स्टार्ट डाइजेस्टिंग देम. थ्रेड्स इज ऑल्सो गुड ऑप्शन फॉर जॉ लाइन एंड नेक, क्योंकि वो ऐसा पुल करने की वजह से यू गेट दैट लिटिल चिजल्ड जॉ काइंड ऑफ अ लुक. एंड इन सम केसेस जिनको थोड़ा फैट एक्सेस है या डबल चिन है, for them we can also do liposuction. That is also done under local anesthesia. So we suction the fat out, which lets the skin tighten. और फिर वो contour defect आ जाता है for the lower jaw.
How often you have to repeat this? Like,
so most of these procedures are every 2-3 years. It is like that.
And for 2-3 years they give good results.
They give good result. Yeah.
उससे ज़्यादा भी चलता है किसी का?
Surgical उससे ज़्यादा चलेगा. Non-surgical is generally for 2-3 years. सर्जिकल अगर करो तो 5, 10, 15 years भी इट कैन लास्ट.
एंड डॉक्टर, जैसे फैट किसी का बढ़ जाता है प्रेगनेंसी के बाद, आपका स्किन लूज हो जाता है, उसके लिए व्हाट इज द बेस्ट?
सो प्रेगनेंसी में टिपिकली क्या होता है, द यूट्रस बिकम्स बिग, सो द पेट के जो मसल्स है वो स्ट्रेच हो जाते हैं, स्किन स्ट्रेच हो जाती है, एंड ऑफ कोर्स एज अ nourishing mechanism, your body tends to put on fat in certain areas. So these are generally love handles, thighs, sides of the chest. All these areas will put on fat. So usually I tell my patients who have just had a baby or who have come with that concern, you wait for 1 year, let your body recover from the pregnancy changes, and then we will, if the skin has not shrunk back to what it should have, or your muscles have developed a gap in the midline, then the procedure we do is called a lipo tummy tuck. So we do liposuction of the sides of the waist and the back also a little bit. And जो पूरी excess skin with stretch marks और जो lose हो जाती है, जिसको जो basically ऐसे fold की तरह रहती है under your pants or under your sari level, उसको निकाल देते हैं. And that gives a full flat tummy with a very good 3-dimensional shape. Now this same thing applies also to patients who have lost a lot of weight.
weight loss के बाद भी.
So bariatric surgery समझो की है या कुछ medicines ली है जिससे 20-30 kilos suddenly एक साल में कम हो गया. तो these patients develop a lot of loose skin. उनके inner arms में, thighs पे या lower tummy पे बहुत loose skin आ जाती है. So इसके लिए the procedures which we have are called as body contouring procedures. So इसमें arm tuck हो गया या thigh tuck it is called, where the thigh skin is cut out and it is tightened, या belt lipectomy हो गया. All these are procedures which are, you know, the names are such. Lower body lift होता है, upper body lift होता है, जिसमें basic premise of the procedure is कि underneath जो muscle है उसको tighten करेंगे, और जो सब extra loose hanging skin है जो ऐसे हाथ में पकड़ सकते हैं वो सब निकल जाती है. All these procedures, the only side effect is that it will add a scar. But the scar is such that it hides under your undergarments. So it comes in a bikini line or it will come in the thigh line, which will not be seen routinely. Even if you wear a swimsuit, these scars are not seen. So the skill is in hiding these scars and still giving you a flat, toned body. So that's why these procedures are quite popular, especially with people who have lost a lot of weight.
And doctor, what is liposculpting, which is trending these days again?
Yeah, so liposculpting or 4D, four-dimensional liposuction. These are newer procedures which are gaining popularity. So basically what we do is we use advanced liposuction techniques such as ultrasound liposuction or power liposuction. And we suction more in certain areas and less in the other areas, creating an illusion. So the commonest thing which we create is this central line in the tummy, which we can create in females, which gives the appearance of a toned stomach, or in men, which gives a six-pack appearance, or in the chest, where we give appearance of, you know, really chiseled, toned pectoral muscles look. Or we can even do it in the arms to give the appearance of a bicep. So this is where we aggressively suction with the liposuction in one area, and we suction a little less in the other area, so it gives like a three-dimensional look. And because it's done with liposuction, it is called 4D, an added dimension.
ओके, सो डॉक्टर देवयानी, यूजुअली पेशेंट्स जो होते हैं वो घोस्ट डॉक्टर्स से डरते हैं, जहाँ जो मेन डॉक्टर होते हैं, जो सर्जरी करने वाले होते हैं या होती हैं, वो कंसल्टेशन के लिए दूसरे पेशेंट के पास चले जाते हैं और उनकी जगह कोई नौसिखिया डॉक्टर या असिस्टेंट मान लीजिए कहें, वो ऑपरेट करते हैं। तो ऐसे में एक पेशेंट को अपने डॉक्टर से पहली कंसल्टेशन के दौरान क्या सवाल पूछने चाहिए जिससे कि उसको ट्रस्ट हो सके कि मैं सही डॉक्टर के पास आया हूँ और सही जगह पे हूँ?
सो जो सिनेरियो आपने पेंट किया वो होता है अनफॉर्चुनेटली इन सम प्लेसेस, स्पेशली कुछ चेन्स में और ऐसे सब स्मॉल प्लेसेस में ये हो सकता है। आई ऑलवेज टेल माई पेशेंट्स कि आप प्रोसीजर इतना रिसर्च करते हो, आप डॉक्टर को भी रिसर्च कर लो।
ट्रू।
आप यू कैन चेक व्हाट देयर डिग्रीज आर। नाउ आवर महाराष्ट्र मेडिकल काउंसिल विच इज अ गवर्निंग बॉडी, उनके वेबसाइट पे आप पेशेंट डॉक्टर की डिग्री भी चेक कर सकते हो।
Okay.
So you can always do your research on your doctor also. Find out what their qualifications are, whether they have trained enough in what procedure you're looking for. What hospitals do they go to? उनका थोड़ा सा गूगल सर्च कर लो, देख लो उनके पास्ट एक्सपीरियंसेस क्या है। जब आप कंसल्टेशन के लिए आते हो तो not just about your procedure, but you can always ask the doctor to show if there are any examples of what they have done before. So I always make it a point to show before and afters to my patients, to give them an idea कि ये हुआ है, अच्छा रिजल्ट भी आ सकता है, कभी कभी कुछ अगर अच्छा नहीं हुआ है तो I show that also कि some patients may have a delayed result also. So you paint the whole picture. So make sure अगर कोई बहुत अच्छा ही सिर्फ दिखा रहा है तो everybody should know that that may not be the actual case. True. Because when you do enough number of cases, you are bound to have some delayed results or some complications somewhere. So ask your doctor honestly about that. If they are honest enough to tell you, you will get an answer. Another thing is what you said about ghost doctors. So I always tell my patients that ask your doctor upfront that where are you going to do the surgery and are you going to do the surgery. So a lot of my patients do ask me, which I'm very happy about, because they should. In fact, from my patients only I came to know about this concept of ghost doctors, because they told me that there somebody known to them had experienced something like this. So this is a very serious issue. Another thing I tell my patients always is, in the first consultation you may not have all the questions ready. So of course when you come for your consultation, do a little research, note down your questions. That's fine. I will give you the time for that. And अपने हमारे discussion के बाद, if you have any more questions, make sure you jot it down. True. So when we speak the next time, or when we do a second consultation if required, then we will definitely go through whatever questions may have come up in your mind. मैं आपको इतनी सारी information दूंगी in that first consultation that you may not know everything. Google doesn't tell you everything. True. So जो कोई नए questions आते हैं या whatever new doubts you may have, just make a note of them so that we cover everything before you take the final decision whether to do surgery or not.
कॉस्मेटिक सर्जरी से रिलेटेड यदि आपके भी कोई सवाल है तो नीचे कमेंट बॉक्स में जरूर लिखें, ताकि हम अलग विषय पे अलग अलग एपिसोड बनाएं और डॉक्टर देवयानी को दोबारा बुलाएं। थैंक यू सो मच डॉक्टर, आपने इतनी महत्वपूर्ण जानकारी हमारे व्यूअर्स के साथ शेयर की।
थैंक यू सो मच फॉर हैविंग मी।
We'll meet again.
Yes.
Thank you so much.